Good afternoon, everybody. This is Deborah Jones, your Blue Table Talk host, along with my co-host Toria. Hey, Toria.
Hello, how are you?
Good. So we have a great show tonight. We have Jackie Simeon along with Doctor. Now let me say his name right. Nawobi. That's that right?
Yeah.
Okay, cool. And this is Texas Fibroid Awareness Month. So Jack is going to tell us about it, and because she has a event coming up real soon, and she's going to tell us about it. Then we brought along Dr. Nawobi with us, so we can talk about what she does and everything. So y'all, before we even talk to these two ladies, don't forget, y'all, COVID is still out there. My sister has it right now, and she said, "Don't come to my house because I have COVID." So I said, "Girl, don't you worry," because I've been around too many people lately that has it, and you think it's gone, but it's not. So
I've been to two conferences
yeah,
where there was an outbreak following the conferences. So yes,
yeah,
you'll
and
need to be careful. And if you have the symptoms, stay home, stay away from people.
stay home. And I went to two reunions, and that's how there was an outburst over there, and I'm like, okay, y'all, I'm staying home because I do not want it. I'm a diabetic, and I don't need to have it. So that's where it is now. But like I said, y'all, COVID is still out there. So let's take care of ourselves and take care of others as well. And let me tell y'all, God has blessed us again. He has passed over Beaumont, Texas, and
Yes.
he just dropped a little tear right in Beaumont and kept moving. Now, some people lost their electricity, and some people has been restored today. But then they said earlier that some people won't get there until next week. So yeah, but let's keep everybody in prayer. And if you can see someone you can help, please help them.
Yeah,
Okay.
I have a friend who lives in Houston who just got a notification saying that it could be several days before.
That's
Mhm.
bad. And it's hot out here. It's
Yes, it
hot.
is.
So, let's take care of ourselves and take care of our neighbors and take care of everybody so that we can just what you call that? Pay it forward. So come on, let's do this. Okay, so I don't have to introduce Jackie Simeon to y'all because a lot of you all know Jackie, and so some of you may know, some of you may not. But this is Jackie Simeon. Hey, Jackie, how are you tonight?
I'm doing well. And look, I always introduce myself because I have been called Cecile Rant more than once. I don't know if y'all remember
Oh
Cecile.
yes, yeah.
So yes, I've been called Cecilia Rant more than once. So I do not take for granted that everybody knows who I am. I always stick out my hand and I say I'm Jackie Simeon, just in case they're not quite sure. But Cecile, is a lot taller than me, so
Yeah.
I don't know how they.
I don't know how either because I'm gonna say something else.
Right, right. She's
Yeah,
right. For those of you who don't know, yeah,
yeah,
there's
yeah.
that aspect also.
Right, right. And then we have Dr. Nawobi. You want to introduce yourself?
Absolutely. My name is Dr. Obi, and I'm a native of Southeast Texas for 26 years now. So I've lived here for 26 years. I'm originally from Nigeria, and I've been in healthcare for close to 20 years. My career started the Christus Health emergency room, and which went into the community. And I am currently the behavioral health director at the Federally Qualified Health Center, Gulf Coast Healthcare Incorporated in Port Arthur. And I have been doing that for about 7 years now because primary care is so important because that's where we kind of see firsthand and able to treat people and kind of help people before the disease or the condition progresses. So I have been doing that, and I'm a family nurse practitioner, and I'm board certified as a psych and family, and I have also had the pleasure of working with a lot of people in the community in bringing awareness to several diseases, several illnesses, because I feel like information is so empowering. And sometimes we do take for granted that they know, but most people really don't know. And when you give them the information and they are aware of what to expect, I think you've done half of the work. So my goal is always to give this information, empower my patient, give them the language so that they can be advocates for themselves, because you have to advocate for yourself and not wait for somebody else. But if you don't know what to say, or if you don't know what question to ask, then you're not going to be able to advocate for yourself. I'm very passionate about substance abuse because it has wreaked havoc in the community. And like I said, I do bring awareness to that. And I'm a mom. I have 5 children, and I just try to be a part of the community. I go to the same church with Jackie, and our kids went to the same school, so I've known Jackie forever. And but I love what I do. This is one of my passion, just spreading awareness about different things, and how it affects our health.
Right, right. Well, Jackie has a event coming up real soon, and this is Texas Fibroid Awareness Month. So, Jackie, what would you like to expand on it?
Sure, yes. And although I said my name, I did not say what my affiliation is or how I'm tied into what we're talking about tonight. I recently joined the team of the Barbara Jordan Leadership Institute as their development director. And for a few years, I volunteered with them. The Barbara Jordan Leadership Institute is based out of Dallas, Texas. And of course, it's named after the great Texas stateswoman, Barbara Jordan, the lawmaker.
Right.
And what the organization does is it helps to empower people in communities. It's an advocacy organization. We do voter education, as well as educating people about health issues as well. So that's where this event comes into play, the Fibroid Awareness Self-Care Day, which we are going to be holding at the Lamar Institute of Technology Multipurpose Center. That's the Paul and Connie Such Multipurpose Center on the campus of Lamar Institute of Technology. That event is going to be held Saturday, July 20th. It's from 10 until 2, and it's just a day of fun. We'll have Team Tebow out there with their 360 cameras so that you can take pictures. Of course, your organization, which I'm a part of, the Southeast Texas, the Line Steppers group, will be doing a couple of demonstrations. We'll have vendors out there selling things of all kinds. From candles to women's clothing. We'll also have health organizations out there doing health screenings. Dr. Nairobi participated last year. We did a question answer session.
Right.
He was a part of. And Deborah, you've been a part of this for the last 2 years as well. So this is the third year we've done it. Right. And Beaumont should be so proud because this event has only been in existence. This is only the third year that it's run in the state of Texas. And we joined several other cities. So it's only done in Houston, Waco, Fort Worth, Dallas, I believe is the other city, and Beaumont. So it's only 5 cities in the entire state of Texas. And Beaumont was the very first city to do it 3 years ago. So we should be very proud of that. And it is a free event. Got to stress that it's free. For the last 2 years, Charlie's Barbecue provided lunch for the first 200 people to come through. And they're doing the same thing this year. So you'll get free lunch, free admission into the event, free lunch, line dance lessons, and a chance to get some healthcare checks and talk to healthcare professionals about a variety of different subjects. Linda Clark, who's a psychotherapist, she joined us last year and she'll be joining us again this year as well. And Dr. Nairobi had a great session last year.
She did.
A lot of women have questions that, maybe they, for whatever reason, haven't asked their doctor. And this is an opportunity for them to, listen to other people and their concerns as well. So great session. We hope people will come out for this.
Right, right. Yes, yes, I've been out to every last one, the first and second. I've been having a great time. I mean, I thought I was gonna make it this year. So
yes, I was a little worried when you told me you had another event. I said, oh no, because y'all were one of the highlights, definitely a highlight of the event was the line dancing session.
Yeah, and
we did 2 sessions.
Yeah, you have great, like you said, you have some great people out there, health services, all types of people out there to talk to us about everything.
Right.
And that has been great. And everybody, it is free. So if you guys have any questions y'all want to ask, go ahead and put it on the web, and I would throw them to Jackie, and I would throw them to Dr. Nwobi, and let you know. Now, Dr. Nwobi, you are a behavior health person, right? Right?
Yes, so and family medicine too. Absolutely, yes.
So what's the difference between the mental health and the behavior?
They're both the same. They're used interchangeably. Mental health, behavioral health. The field is behavioral health science. And under that you have the mental health. So they can be used interchangeably. I use the behavioral health because at Gulf Coast we have under the behavioral health department, we have the mental health, we have substance abuse, we have counseling, we have all of that. All that encompasses behavioral health.
Right. Right. So when you guys come out there on the 20th of July at the Lamar Institute of Technology, you can ask Dr. Nwobi all these questions that you want to ask her, and she would be more than happy to answer them for you. You can ask Jackie as well. And Jackie, I just love you. I just love you.
I love you, and I love line dancing. I look forward to the sessions on Wednesdays. I mean, that is my exercise. I love it.
Yeah.
And once I learned the Tamia line dance, I felt like I could learn anything in the world.
Me too.
A lot of people say that. Well, I got the Tamia down now. I can go do whatever. So,
right.
But you got it down.
I do. I'm so proud.
I got this.
I let everybody know that I know. Every time it comes on, I never pass up the opportunity to do that dance when the song comes on.
Right. What else is going on at the self-care forum? I know you said you have doctors and nurses over there. What else do you have over there?
Yes, as I mentioned, Linda Clark, she's a local psychotherapist. So she also will be talking about mental health. But I want to rewind just a little bit and give some more history on this event. So in 2021, what I want people to know is that the state of Texas passed 2 pieces of legislation recognizing the need for awareness of fibroid symptoms and causes. And it is a health dilemma that affects many women during their childbearing years. It affects a lot of Black women. And so to accomplish the intent of the bills, awareness campaigns such as the self-care fair have been established. And this is to help broaden the public knowledge of the condition. And Beaumont, as I said, it was the very first of 4 cities that was selected by the Barbara Jordan Leadership Institute to host such a fair. And so we want you, again, bring out the kids. It's a fun family event. Yeah. And I don't want the men to think that, oh, that's just an event for the ladies. I'll let the ladies have it. They should come out too. You can get your questions answered as well. We had some ladies from the Gift of Life and gentlemen from the Gift of Life. And as you know, they provide prostate cancer screening as well as breast cancer screening. So this isn't it is not an event just for women. It's an event for the entire family. We want the men to come out, get some health screenings done, get their questions answered. Let the kids come out, have a good time, get them a free lunch, let them run around. It's just going to be a fun morning and afternoon for the entire family, and it's free. So what more can you ask for?
So why did you become a part of it?
Oh, I was first approached by the Barbara Jordan Leadership Institute a few years back during the campaign, the Ted Cruz and the why is his name slipping my mind now? But it was during a political season, and they contacted me from a recommendation. Okay. They had never heard it. They didn't know who I was, but somebody recommended them to contact me. And I'm sorry, Beto O'Rourke. I can't believe that I
Okay.
had that little freeze there. But when they contacted me, I try not to get involved in politics. I'm always going to be a journalist at heart, so I want to remain unbiased. But the opportunity to work on a national campaign,
Right. Right.
this campaign was getting national attention. It was just something that I could not pass up. So I was a liaison for the Beto O'Rourke campaign in Southeast Texas. So that was my first interaction with the Barbara Jordan Leadership Institute. And we've been in contact ever since. Anytime they need something in Southeast Texas, they call on me and I do my best to make it happen. And thanks to people like you, Deborah, Toya, Dr. Nairobi, thanks to the friends and connections I have, I can make those things happen. I don't do it alone. So I'm very appreciative of the friends and connections that I have in the community.
Awesome. Awesome. Dr. Nawobi, did you want to say something?
Yeah, I was gonna say not only because I know last year I gained some patients because sometimes, people have questions and they don't even have a primary care provider. They don't know where to go. Somebody who can relate and somebody who can really understand. So that last year, I gained some patients that followed me from that. So you can come out there and, see the various health organizations or the clinic, and you just never know who you might align with in how they practice, and so it's a lot of benefit just coming out besides the eating and having fun. It can be your beginning your journey towards your health.
Right.
And I want to say I'm still looking for more vendors. And the great thing about this event also is that vendor space is absolutely free.
Okay.
I have been a vendor at events where the fee to be to be a vendor, you don't even make it back, with your sales.
Right. Right.
So
Right.
that's why it was really important to me that this be free for those vendors so that they make all profit. But in order to keep that going, I need sponsors.
Mhm.
So we have different sponsorship levels. Our presenting sponsor level starts at $5,000. And then our partner sponsor level is 2,000. Our associate sponsor is 1,000, but we'll accept any donation at all. Uh, Commissioner Bo Alfred has been one of our sponsors in the past, and he's working with us once again.
Mhm.
Hyundai of Silsby is also serving as a sponsor, as well as the Pitzer Family Foundation, formerly known as Creative Corrections Education Foundation, correct? Creative Corrections Education Foundation. So they also have been a sponsor for this event. So if you are interested in either being a vendor for free or being a sponsor, and with sponsorship, you get to put up more signage, of course. We have commercials that'll be running on local television stations and radio stations. So your name will be out there with all of the publicity that we do. If you're interested in being a vendor or a sponsor, you can just contact me on social media.
Okay, I have some questions out here that our listening audience is putting out. One of them is a guy, and he says, "Why? Hi Terry, how you doing? Why does fibroid disease affect African American ladies so much?"
Well, I wish we have the answer to that, but we don't know. The answer is we don't know why it picked the African American community more than the other ethnicities. But what we do know from research is that there are certain risk factors that kind of predisposes, a
Hmm.
woman to developing fibroid. And not I feel like, I was talking to Jackie today and I said, do we have like a support group or something? Because you can never take away the experience of somebody who has lived, the lived experience of somebody who has, suffered the fibroid, went through. You can never, match that experience. So sometimes people with lived experience bring a lot of experience to the table. So we don't know why African American women suffer more than the other ethnicity, but we know that genetics play a role. Research shows that if your mom has fibroid, you are 3 times more likely to develop fibroid. And, other risk factors, talking about diet, like red meat, consumption of red meat. You're talking about obesity, those things are the things that I hope the audience will be able to ask questions, because like I said, if you know, you do better, so that we
Mm-hmm.
have this information and know what to do with this information, and then we can make better choices about our health and know where to go from there.
And of course, I'm not a medical professional, so please correct me if I'm wrong, Dr. Nairobi. But of course, I've been reading up more on fibroids since becoming a part of the Barbara Jordan Leadership Institute and hosting this event. The cause of fibroids is not even known, correct?
Yes.
So we
Yes.
don't even know what actually causes fibroids, period, in any women of any ethnicity.
Right.
Yes. And
Right.
we don't know, because usually the women between ages 30 and 50, that age range is a risk factor. And after menopause, we still don't even know what, because research shows that after menopause the fibroid shrinks. We don't know what happened, we don't know why it shrunk. So yes, we don't know what causes a fibroid, but we also have to understand that, yes, we don't know, but there are some risk factors that we develop that, we can change. We can change those risk factors besides genetics, what we consume, our physical activity, all of those things that are within our control to change, so that we can slow the progression of that.
Here's another question from, I don't want to get her name wrong, but she's Shani.
Well,
Now,
we
well,
know this young lady. This is Chinye. This is Dr. Nairobi's daughter.
okay, she says, as an African American woman, how soon is it to get tested for fibroid disease, and what is the process of the detection? Hopefully, that makes sense.
Wow. Thank you, Chinye, for asking that question. Yes. I would say that, the prevalence is so high. I remember when I was training, and uh, when I was training during my women's health rotation, and um my preceptor, when sometimes or most times when they come in for their yearly exam, their pap smear, checking the uterus, the ovaries, and all of that, that's when they find it. If you have fibroid, they feel for it in the uterus, which is the womb. And
Mhm.
it's not like a specific testing. Sometimes accidentally, when you come in for your yearly exam, and I will say to women, and I always say to my patients, your birthday, you should have your report card. Your report card, meaning your health score, your report card. You should have gone to your GYN. You should know what your blood pressure is. You should know where your weight is at. Do I need to lose a few more pounds like me? Or do I need to, you should know all of those things. You should know your cholesterol level. You should know all of these things. They are very simple things, so simple that if you know these things, it takes you another year than put it off every year, and then things happen and it gets bad, it gets out of hand. We don't want that to happen. That's the reason we're doing this today. We don't want that to happen. So back to her question, when we find this, and some women may have fibroid and don't have symptoms.
Mhm.
Not everyone that has fibroids do have symptoms, but sometimes they do have symptoms like the abdominal pain. They come in for abdominal pain, they come in for too much bleeding, they come in for in between bleeding during their period, they come in for anemia, because when you lose so much blood, women were already at risk for losing blood every month, and on top of that you're losing more blood and you become anemic. So we find all that out. So once that is, found out and you have problems, we can do ultrasound, to see the size of the fibroid, to see, what medications you can benefit from. We can do all of those things. But, I would say first things first, women of childbearing age, make sure you have a relationship with your doctor, with your primary care doctor. And good thing, we have a lot of good primary care providers that can do the simple exam to find out if you have fibroid. Is it giving you concern? You have symptoms from it, and then we can take it from there.
Okay, okay, okay. Virginia Knowles wants to know. She said she had fibroids, and then she had to have a complete hysterectomy years ago. So usually, when you have the fibroids, you usually have to have a hysterectomy behind it.
You don't have to. If like when you have fibroid, some people have it and it doesn't cause any problems for them. But when they start having complications from the fibroid, some people even have infertility, some people have miscarriages behind the fibroid. It depends on, and sometimes it can grow as much as, some people think a woman is about 4 or 5 months pregnant because it can grow to the size of, that pregnancy. And if it sometimes it does affect their life functioning, like everyday life function. Now, that's when, okay, you have to see somebody. They will try other things. Surgery is not always the first to go, but if it's causing problem and they've done all other things and surgery is just to take out the whole uterus, then that's an option that, but usually, it's an extensive discussion with your doctor to see what options are best for you.
Recently, I was on a panel, maybe it was last week, also talking about fibroids and talking about the upcoming fair. And this woman said she was lying on her sofa and she felt something. I didn't even think it was possible to feel, the fibroids yourself. So that was something that I learned hearing that from her on the panel, that she actually felt some type of growth there, and that's what made her get checked, and that's how they discovered that she had fibroids.
Does it
Yep.
have anything to do with PCOS?
Yes, well, PCOS is, the best way I can explain PCOS. Every single one of us, polycystic ovarian, syndrome. Around our ovaries, we have like little grapes, little grapes. Sometimes it bursts, sometimes it gets bigger. And then the PCOS can also affect other hormones in the body. So fibroid and PCOS are separate. They are separate treatments for each one of them, but sometimes the symptoms can kind of mimic each other. But the best way to find out is through this, diagnostic testing, and make sure that the ultrasound is showing the uterus and showing whatever is, and the ultrasound can even measure the size of the fibroid. It can measure how big, how small, and sometimes, there are medication that they can use not to shrink the fibroid, but like with the bleeding, sometimes we can prescribe low dose oral contraceptive,
Mm-hmm.
because fibroid is always an interplay of the hormones, the estrogen and the progesterone, which is what we have, especially as women. When we're pregnant, we have those high levels of estrogen and progesterone. So it's usually, they do give you that low dose oral contraceptive to kind of decrease the bleeding. Can you imagine somebody who bleeds 30 days a month? That has got to be, I mean, I don't even know. That has got to
Yeah.
be so uncomfortable and impacting every area of your life. So to decrease that, we do prescribe low dose oral contraceptive, but and manage your pain and all of that. The good thing is making sure that is diagnosed appropriately and having that talk with your doctor to find out what's your best option.
Right.
Again, that same panel I was on last week, the woman who was speaking about having fibroids talked about how during her period she could not go anywhere because the bleeding was that heavy. She got in her daughter's car once and just, bled all over the seats. It was just a huge problem for her. She was really incapacitated during her period. She could not go anywhere.
Right. Right. Well, in my case, I'm just like Virginia. I had to have a hysterectomy. The doctor found out that I had fibroids, but the fibroids was cancerous. So
Oh,
they
wow.
had to take both my ovaries out. And so I was like, I really didn't know what it was about anyway, but I knew I never had pain during my menstrual period. I never in my whole life had it. But it was just at a certain time I started having pain. I didn't know what that pain was, and I found out it was those fibroids and
Mm.
everything. So he did take it out, and he took the ovaries out as well. So look, I got a lot of questions, people talking right now. So let's go back to the board and see what they're saying. Henrietta Savoy, hey Henrietta, says my older sister has fibroids and would be having a hysterectomy at the end of the week. Is there a greater chance that I would have this problem?
Like we mentioned earlier, genetics play a role in developing fibroid. Not that it's 100% absolute, but it says that if a mom has fibroid, the daughter is likely three times likely to have that. But I would say if your daughter has it, go to the doctor and talk to your doctor. If you go to I can't stress this enough, because you know why I do, because sometimes when I see them, it's kind of late. I'm like, what were you doing? When you
Right.
started having the
Wait so long.
symptoms, what
Yeah.
happened? Why didn't you come early? So if we haven't achieved or accomplished anything today, is please go to your doctor. Just go get your yearly report card. Go and they would, give you that report. And what I would say to you is, if you're not having any problem, make sure you go to your doctor so that you at least know your status. Okay?
Yeah, and in this case, it's an older sister,
Right.
so she should still, have some concerns and get it checked out.
Right.
Yes.
They can have it. They can, and when we get our pap smear, they can see whether or not you have fibroids.
Yes, that's what when you go for your yearly exam, because we have, we do the speculum and then we do the bimanual, which
Mm-hmm.
is with the fingers. You feel
Right.
around the uterus,
Right.
and that's when because it can be anywhere, either on the walls or inside, or you can feel where it is, and you can actually tell what size. But definitely, the ultrasound can pinpoint the exact area it's at.
Mm-hmm. Cheryl Chambers says, can you display the contact information again regarding vendors, Jackie?
Yes, again, you're on Facebook, so you can just send a message to me, and I will send you the link for that for the vendor space.
Mm-hmm.
You can also, I have fly. As a matter of fact, if you go on my page right now, I don't know why I didn't think of this before, but if you go on my page right now, the cover photo has all the information about the actual event. So yes, please, if you're interested in being a vendor or a sponsor, just send me a message on Facebook and I'll get you the link.
So when do you start reaching out to for your sponsors? Is it right after the event right after the event, or you wait to the beginning?
Not early enough.
Yeah.
Not early enough. The organization did not contact me until really maybe a month and a half ago or so. And I think they might have a little bit too much confidence in me. They just think, oh, she'll make it happen. But yes, if I'm being honest, I really should reach out to sponsors a whole lot earlier. And now that I know that this is something that they definitely want to do
Yes.
every single year, I will be reaching out for vendors and sponsors probably almost immediately after this event. When I send out the thank you notes to the vendors and thank you notes to the sponsors, I'm going to ask for a commitment at that time for next year, because we usually know what the date is going to be.
Right.
It's usually the first Saturday. Beaumont's is usually the first Saturday in July. And the other city is Tyler, because Tyler just had theirs last weekend. And the only reason why we didn't do it this first Saturday is because it was July 4th weekend. So it was a weekend. So I didn't want to do our event during a holiday weekend and have to compete with all the other events and family gatherings and holiday events. So this year it's on the 20th, but next year I'm planning for July 12th. So it'll be the second Saturday next year. I just don't want to have it too close to the 4th of July.
So you're going to be moving it out of the Lamar Institute to go somewhere else because
That is the hope. That is the hope. And really, we said that last year. Last year, it was so
yeah,
good that I was saying, hey,
yes,
next year we'll probably do it at the event center.
Mhm.
But because I started on it so late, of course, the event center was booked up and a lot of other places were already booked. Fortunately, LIT, their multi-purpose center, was available. So we'll
right,
just squeeze in there for
yeah,
one more year and
right,
have a great time out there.
yeah, yeah. Okay, so let's see who's next. Terry Roy again. He says, "Is undetected fibroids the reason that some ladies may have issues becoming or staying pregnant?" Yes.
Yes, yes, yes. And I'm not saying it emphatically yes, but it could be a huge part of the reason because remember, we did say the complications and the symptoms and all of that could be infertility, or miscarriages, or, there are other things that, yes, I would say yes, it can be.
Right. Wow. You never think of these things. We just go on our daily lives and just keep going. And if we heard, we just go to the doctor. We're not knowing that we have fibroids or anything like that. But
You know
let
what? And the other thing is, I don't think we talk about it enough.
enough.
Once you,
Yes.
once you bring it up, you start finding out, oh wow, she has fibroids.
Mhm.
This friend has fibroids. This person has fibroids. I just don't think that we talk about it enough. And if we did, that could we'd really be doing a service to each other if we talked about these things a
Right.
little bit more, shared our experiences, and shared, what we did to overcome this or fight through it.
Right. Right. Wow. Let me see what they're saying is. Oh, it's just saying this is wealth information. Yes, it is. Great information. Okay, so
I'll just say this. In my case, I don't have or did not have problems with fibroids, but I did suffer from heavy bleeding. And it was recommended to me that I get a hysterectomy. But since I was a child, I would hear my mom and her friends talk about hysterectomies, and it sounded like the worst thing in the world. Like you want to avoid that. But then at the same time, it's almost like a rite of passage in our community
right,
because so many of us, that's the path we're put on, or so many of us, that's what we opt to do. But when I was suffering with heavy bleeding during my periods, I was really looking for any other alternative. What other alternatives are there? Do I have to get a hysterectomy? Surely there's something else I can try. So one doctor recommended, and what is the name of it? Help me out, Dr. Nairobi. It's a method where the lining of your uterus is burned. I can't
Ablation,
ablation.
ablation.
Yes. So I had ablation instead of a hysterectomy, and that's where they burn the lining of your uterus,
okay,
and then so that stops the bleeding, and it grows back very, very slowly, and then once it grows back,
Yes.
then your periods should resume, or may not resume, and so that's what I opted for instead. And I can just tell you, it worked for me. I did not suffer from heavy periods again. I've had no other problems. So I'm so happy that I was able to keep all of my parts. I still have both my ovaries.
Yeah.
I didn't have to go through the pain of having a hysterectomy, and I had my problem taken care of thanks to ablation. So that's what I opted to do.
let me see. Yvette Macaulay says endometrial stroma sarcoma tumors were hidden inside of my uterus and thought to be a fibroid. I had more than 10. Wow. Please have
Probably she's probably
exam. And that's
Yes.
yeah,
Yes.
125 yearly. Don't take no for an answer. And so what is CA 125?
It's like cancer, they test for cancer antigen. So it's part of when you go to your doctor for your yearly exam. It's part of the things that they test. It's a cancer tumor antigen that they
So
test
just
for.
the fact that Deborah had to ask what it is, I also didn't know what it is. Why aren't they telling us about this
Right.
test?
Because the thing is, when I can't speak for everybody, but I will tell you based on my experience, okay? Based on my experience, most women, especially in the African American community,
Mm-hmm.
they come in when they are having symptoms and you're trying to alleviate the symptoms that they came in for. You know, it could be abdominal pain, it could be excessive bleeding, it could be any of those, right? They're anemic. You're trying to replenish their blood volume to normal. You're trying to take care of the immediate, right? And sometimes your goal is to kind of stabilize them and you want them to follow up. Guess what?
No follow up.
No follow up.
Wow.
And that's why I think it's so important that we talk about this. And when you're stable enough, you're not having the bleeding like you are, and this takes time. You know, it's not a one time thing. You're stable enough, the bleeding has subsided, you're not fainting or you're not passing out, you're not feeling like you're, because
Right.
being anemic can cause some of those symptoms. You can actually pass out from low blood counts, and that's
Right.
anemia. And if I'm trying to replenish that blood volume, giving you some iron supplement, trying to do all of that, and you're stable enough, please come back. Because we've addressed one thing, but we have not addressed the others. So that's why follow up should be it's a type of relationship you have with your primary care provider.
Right.
It's not just, it's something, if you have concerns, you go to your primary care provider. And we the primary care providers don't have the answer to everything, but we know where to tell you to go. We know that if we test for this and we find something abnormal, I'm not GYN, I'm not OB, I'm not that, but I know where to refer you to for further treatment or for further evaluation. So we are basically the gatekeepers, right?
Mm-hmm.
Like if something is wrong with your blood pressure and I'm checking your blood pressure, and it's not, and then I can prescribe something for your blood pressure, make sure the medicine I'm prescribing is working, right? Or you have diabetes. That's why we're the gatekeepers. The primary care providers are the gatekeepers. When we find these things out, we tell you where to go next. You know, if you have to see somebody to discuss further, and I always tell my patient, always get a second opinion. If you
Right.
don't feel like you're heard, if you don't feel like your primary care provider answered all your question to the, like you understood everything because it's your right, please seek a second opinion or even a third opinion
Always.
so
Yeah.
that you know what you're facing.
Right.
And
Absolutely.
quit going on WebMD and trying to diagnose yourself.
Googling. You know, Dr. Google has caused
'Cause
so
I
much
Google, I
trouble
Google
that
everything.
I
I
mean,
Google
I may
everything.
look it up, but I don't stop there. Like some people, that is their go-to, and they don't see a real medical professional.
Right.
So stop
there
self-diagnosing.
are some reputable you know,
Yeah.
like you want to know the prevalence, you know, like how often, how prevalent, how common does this happen. CDC is a good website. You can go just for pre-information, but don't come to me with what Dr. MD said. Are you having the, it's like we're debunking a lot of things, and most of my time it's, and I don't mind. I really don't mind. Most of my time is spent trying to explain to patient in the language that they understand, though, because you have to explain it in a language that they really understand and they get it so they
Right.
can work with you.
Right.
Well, you have some doctors that depend on Google themselves.
Okay, go into them then. Don't go to them. If you know the ones that depend on Google, I will run as far away from them as possible.
Okay. Yvette says, I am a cancer survivor. They will not tell you. You have to be knowledgeable by forums like this. Be your own advocate. 11-year survivor. God bless you, girl.
Congratulations.
God
Congratulations.
bless
Yeah.
you. God
Yes.
bless you.
Kathy Wingate
God
also
bless you.
says, I know this is a little off our subject, but it refers to women's health. They also don't tell you to cover your neck when you go for your mammogram. You have to ask for them. You have to ask them to do it. Hmm. I
I've
Hmm.
didn't
never heard that.
me either. I just
Why
had
Never
would
heard
I
that
of
just
be?
had a
it.
mammogram the other day, and I didn't cover my neck.
Yeah,
I didn't
I
cover my
recently,
neck. I go for my mammogram. What may I know why? Are they screening your thyroid, or
Tell us
what's the
why.
reason? If the Can the listener explain more why we have to cover our neck?
yeah,
Yeah,
I
I
mean,
mean,
I
you
just
learn every
recently
day.
had a mammogram at the Dolphin Women's Center. And I mean, the only thing I know that they tell you, of course, not to do is not wear deodorant.
deodorant.
But
Yeah,
Yeah,
I'm not aware of covering
The
your neck.
neck.
right.
I'm not aware of that either.
She'll come back on. Yvette says Pastor Mira only checks your uterine lining and cervix, not the ovaries or anything else. I also requested a vaginal US. Thank you for this information. Yeah,
Thank you for sharing, because again,
Thank you for
it's
sharing.
in sharing that we learn
We
things
learn
know.
things.
a lot of times.
And guys, let me tell you, when you go to this, and I know you coming to the forum now because you learn a lot just on Blue Table Talk. So when you go on July the 20th to the forum, you're gonna learn a whole lot. You there,
Yes, indeed.
Jackie has a lot of information there for you where you can learn. Dr. Like I say, Dr. Nawobi will be there, and other physicians will be there. So come out there. It's free. It's free to the public. Just don't stop here. Tell your friends. Tell your
Tell
friends.
your friends.
And you know, and let's put this out
Spread the
because
word.
women need to know all of this. You
And
know,
I'm gonna, when we get off of this, when we're done with our this segment, I will put the information on my Facebook page to sign up to be a sponsor or to have a free vendor table. I'll make sure that that is on my page for everybody.
And Jackie, if they aren't friends with you, can they still see it?
My page is public, so
Okay.
yes, everybody should be able to see it.
Okay.
everybody heard that, right? And we thank you, Jack. We thank you, Dr. Nawobi, and we thank you guys have also. But did y'all share this because everybody needs to know? So sharing is caring. So if we share all this information, we'll get everybody out there knowing, and then Jackie will have to move, probably have to move to her event that Saturday somewhere else.
I hope so. Yes. Come out, get your questions answered, get a free meal, learn the Tamia dance that you've been trying to get that you still don't have yet. This is your chance to get all of that done.
Yeah, yeah. Okay, here's Kathy back. She says they thought I had thyroid cancer. I had a complete thyroid entomology at MD Anderson. They took me to make sure I never had a mammogram without covering my neck. So for
Okay,
the
that's
last
what I
8
was
years, I
thinking
go
too.
to St. And they have it, but you have to ask for it.
Yes.
Hmm.
Oh, okay. I know Kathy. Okay. Hi,
Be-
Kathy. Thank you
Yeah,
for watching. And I hope you'll
yeah.
come out Saturday. I had never heard that.
me either. And I
I
Okay.
remember
just noticed that she said something that has to do with her thyroid. And you
thyroid.
remember I said
Right.
maybe it has to do with her thyroid because, you
Okay.
have to cover your thyroid, and she did have some procedure
Hmm.
done on her thyroid.
That is good to know. Thank you for letting us know that, Kathy.
Yeah.
Yes,
Yeah.
thank you.
So that doesn't mean that everyone has to cover the neck, just if they're having thyroid problems, right?
Because she does have a thyroid problem, so they have to protect her thyroid from that. I mean, and
Okay.
the thing I tell you is when you go to the doctor, you can be as comfortable as you want to,
Right.
right? Learn to be advocates for yourself.
Yes.
Right.
Learn if you feel comfortable covering your neck, by all means, ask for it. You
Right.
know, ask for it.
Absolutely.
You're there as a patient, and so should you be treated. So always learn to be advocate for yourself. And being an advocate for yourself is your right.
Mm-hmm.
It's
Yes.
just that we in the healthcare, sometimes it's sad to say, but it's sad, I have to admit it, that sometimes we see healthcare as business. Who's next? Who's next? And we don't take the time to
Right.
listen. We don't
Absolutely.
take the time to hear the patients. We don't take we think we know what recipe the patient needs. Not everybody needs the same recipe. Not everybody everybody is just different, and so should we treat everybody. But
Mhm.
I'm hoping, in the next years to come, we will have more compassionate healthcare provider that are willing to listen. One difference is just listening to the patient and just hearing them out.
And
That
hoping
is
that
true.
they will really believe you. One thing I've read, and you're probably aware of this, Dr. Nairobi, is that sometimes Black women aren't listened to as much, or they're not believed. Like
I have experienced it,
when we say
not
we're in
heard. I
pain,
have experienced it.
right? Our pain isn't always taken as seriously as the pain
Right.
of other women,
Mhm.
So you really do have to fight for yourself and advocate for yourself, and look maybe for health professionals who look like yourself, who will understand and believe
Right.
Yeah.
And it dates back to so many years. The syphilis project,
you. Right.
about, it
Mhm.
dates back to so many, and that is why we in the African American community, we don't have so much trust with the healthcare system. And who is to blame, right? It may be passed down from one generation to another, from one generation, even though you didn't experience it then, but you've heard from families, you don't trust the doctors,
Right.
because of the past experiences where we're treated like animals,
Mhm.
right? And you would rather be home than go to the people that you really I do see that part.
Mhm.
I do see
But
it.
and the
And
other,
that's why I go ahead.
you go ahead, finish your thought.
And that's why I take time to recognize that,
Mhm.
to take time to recognize the fact that I know there hasn't, because we haven't really performed to expectation when it comes to I worked in the ER for 13 years. Okay. And I see how people like me were treated versus how the other people are treated, or
Mhm.
me being a patient, really, in the hospital. And I remember one instance. My best friend is a medical doctor, and we went to the hospital, and the anesthesiologist comes in. I'm standing there, and my best friend is on the bed. Her husband is, and I never go there and tell them I'm healthcare professional. I politely said, what medicine are you going to give her to sedate her?
Mhm.
And she goes, what do you know? And I go, I was just asking a simple question. As a patient, I need to know what you're going to give me. I don't have to have a degree
That's right.
Mhm.
to know what you're putting in my body to put me to sleep.
Right.
Mhm.
Right.
And I took a deep breath and I said, he's a physician, I'm a nurse practitioner. And then her body language changes.
Yeah. Of
But
course.
can you imagine if
If
it
you
were
weren't that.
somebody different?
Yes. Yes.
And that's the beginning of the healthcare services you're going to receive. They're not going to take time to listen to you because, of course, and when it comes to pain management, they say we have high threshold in
The higher
holding pain.
tolerance.
We
Yeah,
can,
where did you get that from?
we've gone through labor without pain medicine. So, so like I said, I hear it. I know this happened. And I
Right.
always acknowledge the fact that it happened.
Right.
But
So
we have to build a relationship to make sure that we save you from, go ahead, Jackie.
yeah, the other thing I was going to say is sometimes the cultural differences too. You may have heard this story. I read this or I heard an interview where this woman was saying how she was in the hospital or in a doctor's office and she kept doing like this. And so the doctor wanted to have her evaluated for a mental health issue because he didn't know why she was doing it. Now we have two women on here with braids. Okay, they know why. They know about
Yeah.
pain. But this is because you can't. When you have braids, you
Yeah.
can't
Itch.
scratch your scalp. So the only way
Right.
to get relief when your scalp is itching is to
Mhm.
pull
Right.
your head. You know, Beyonce famously said it in one of her songs, "Ladies, patch your weaves." You know? So,
Mhm.
you know, they don't, but because this was a doctor, a white doctor,
Yeah,
she did not know, why is this woman patting her
Like
head?
that.
yeah,
She
yeah,
needs, she has a mental health issue. She needs to be checked out.
yeah. And
So it's,
because that, that's what they see, and that's how they're wired, to okay, I'm gonna go off here. The reason I'm in mental health is part of this reason, because sometimes you want to look at somebody who look like you, so that there
no,
really
shared
some things you don't need
experience.
to I don't have to explain certain things to
Thank
you
you.
for you to understand
Right,
what I'm actually saying, right?
right,
Because the
right,
session will be over before I try to explain to you what this means, or the session will be over and I'm not gonna get what I paid for. And I
Mhm.
always tell my African American young males, they are 10 times likely to be diagnosed with bipolar schizophrenia when in actuality they don't have it. They probably had something in their system that they were reacting to and end up in the ER. But what do they diagnose them with? Bipolar schizophrenia, and it goes on your record and it follows you,
wow.
right?
Mhm,
Even
mhm.
when you're sober,
Mhm.
that is on your record already. So we
Right,
have to educate the public. And sometimes, yes, I would take out that time to listen to you. And sometimes it makes you feel more comfortable because you actually see somebody that looks like you. Then your guard,
right,
your walls are down a little bit and not have to have it up all the time.
right, right.
That is true. And people should know your doctor works for you. You can fire them. I
Mm,
fired
Yeah,
many doctors.
yeah, you can. Yeah.
yeah,
But why can't we do better though? The
You're
thing is,
right.
how many are
right,
you going to fire?
You're
There's
right.
not a lot of them in Southeast Texas, but we also have to do better. We have to, be culturally sensitive and be humble. If somebody doesn't look like us, we have to at least see where they are coming from and try to
right,
understand that.
right, right.
Yes. Because I hate Dr. Peter Nell is retiring.
No, he
Yeah,
He
already
is
point
already.
across.
I know.
not his retiring. He's gone. He
Well,
out of
he
there. He's
gone,
done.
yeah. But
He's gone.
don't
Yes.
I shouldn't even brought that up. I'm getting sad.
Okay, so Kathy said that every woman should cover their neck because of the radiation. Terry
Okay.
Terry said that
Okay.
if there are any truth to being exposed to too much estrogen, make people more of a risk for fibroids.
Not that I'm aware of. Like, you mean exposed to too much estrogen as far as medication is concerned? I don't think there's evidence to that.
Right.
Thank you, Georgine. We appreciate you
Thank
watching.
you. Oh,
Okay,
thank
so
you, baby.
so right now we're talking to Wall says it's time for us to get out here, and I really hate to because I'm enjoying this so much. I have learned so much not just tonight. But Jack, I want you to go ahead and let them know about the event that's coming up real soon because
Yes.
I haven't been wasn't on here when you first said it. So can you go back over it again?
Yes, ma'am. Please mark your calendar for Saturday, July 20th from 10 a.m. until 2 p.m. at the Paul and Connie Zuch Multi-Purpose Center on the campus of Lamar Institute of Technology on Lavaca Street. This event is free. This event is for the entire family. First 200 people get a free lunch from Charlie's Barbecue. We'll have a 360 camera out there so that you can take pictures and post on social media. There will be vendors selling all types of goods. And of course, again, this is to bring awareness to fibroids. July is Texas Fibroid Awareness Month. So this is how Beaumont is marking the occasion.
Right, right, right. Be there, y'all. Be there or be square, like they say. One more question. Milon, you almost missed it, baby. She says, I went to two doctors today who look like me. Ophthalmologist, Dr. Mapp, and dentist, Dr. Provo. It does
Yes.
make a difference. Looking for a new OBGYN.
So am I. So I need a recommendation, Dr. Nairobi. But Yolanda and I both need recommendations on OB-GYN.
Right, me
Oh,
too.
okay.
My doctor was Dr. Being there. So
Okay. Well, no problems. I love representation matters. Believe it or not, it does. It does matter.
it matters.
Absolutely.
It
Yes.
does.
Yeah, he may come out of retirement if you raise enough noise.
I don't think so.
I
He's
don't
on
think
an
so.
island somewhere having fun, and his wife is not going to let it happen.
Right, right,
No,
right.
he's done
I
his due diligence. He has done great in this
he's
community. I
done his
love
He
that
has.
female.
yes,
Yes.
and I really appreciated him. Really did. Okay, thank you guys for coming on tonight, Jackie. I appreciate you so much. And Dr. Nwobi, it's so
you.
nice meeting you and appreciate you guys.
Thank
My
you.
audience, I appreciate y'all for coming and asking questions, but I'm appreciate you more if you're there July the 20th from
Yes.
10 to 2.
Thank you.
Now, you don't have to come there at 10
All
o'clock in the morning, but you can need to come there by 10:30. So you can get everything that's going on, you know?
Yes, we'll have freebies and giveaways also. Yeah.
Yes, and this, I
Yes.
promise you guys, this is gonna be my 3rd year there because she actually the 1st year, 2nd year, and now the 3rd year, and I've been having a great time.
We have a ball. Yes.
Yeah, we have a
Yes.
ball. I can't wait till her speakers get up, then sit down. I can't wait to eat Charlie's barbecue, then sit down, and then I can't wait. Of course, you know I can't wait to line dance. So
Me too. Yes.
so thank you, Toya. I appreciate
You're
you.
welcome.
And
Thank you.
if I can help somebody as I pass along this way, then you know that my living not in vain. God bless you and God keep you is my prayer. Thank you guys because you always support me. So now since you're supporting me, now you got to support Jackie and Dr. Nwobi. Thank you guys.
Thank
See
you.
y'all
So
later.
take care.
Bye.
Bye-bye.